Good morning, everyone. I see people starting to join in. Thanks for joining today for NephCure U webinar on transition care. We will get started right around the top of the hour. So if you'll just be patient and wait, we're going to let people join in. Hi, I see people joining in. Thanks for joining today for NephCure U webinar on transition care with Dr. George. We will get started pretty close to the top of the hour, so just hang in there and we'll get started as soon as possible. Hi, everyone. Thanks for joining. We will get started pretty soon. Just hang on. We're still admitting people into the webinar now. So thanks for being here today. Hi, everyone. Thanks for joining today, our NephCure U. We will get started here in just about 1 or 2 more minutes. More people are popping in, so, but we will get started pretty promptly today. Thanks for being here. Okay, I'm going to go ahead and get started today. Thanks so much for everyone being here today. We are delighted to have you here for our NephCure U webinar on transition care. My name is Kristen Hood. I'm the Director of Clinical Outreach for NephCure. Before we get started, just to let everyone know, you will remain muted today throughout the entirety of the webinar, but I'm going to strongly encourage you to use that Q&A function down at the bottom of your Zoom toolbar. So throughout the presentation, please, please, please feel free to ask questions as Dr. George is presenting, and we will get to as many questions as we can at the very end. I would like to just mention a few of NephCure's sponsors that help make programs like this possible, such as Travere Therapeutics, the Pfizer Foundation, Goldfinch Bio, and Konica. And now it is my pleasure to introduce Dr. Roshan George. She is the Director of Kidney Transplant Transition Program at Emory and the Children's Healthcare of Atlanta. She's also Associate Director of Pediatric Nephrology Fellowship, so she's quite a busy lady. Dr. George's research and publications are also quite noteworthy of her professional accomplishments. She is deeply interested in not only nephrotic syndrome and the role of the immune system as it relates to transplantation, but she's also really invested in the concepts of engagement and activation in youth and young adults as it relates to how they relate to their medical care, which is why she is here today, leading us to this very important topic of transition care. And I have to say, in fact, whenever I was looking for someone to help us and do this webinar today, her name came up in several conversations with some of our top docs that we know at NephCure. So Dr. George, thank you so much for being here today. We appreciate your time and look forward to what you have to share with us today. And with that, I'll turn it over to you.
Thank you so much, Kristen. Can you hear me well? Thank you. I appreciate your kind introduction and for giving me this wonderful opportunity. As you mentioned, this is one of the passions that I have, to safely take care of our pediatric patients and get them onwards to their journey and adventure into adult care. So I am going to get started right away. The objectives for today's talk for me are threefold. I'm going to start by discussing the background, that's definitions and goals of transition of care. And then we can go into analyzing barriers for successful transition. And once we know what those barriers are, let's find a way to talk about how to overcome those and optimize transition of care. And before I start, I just want to mention that I do not have any disclosures. So what is transition and how is it different from transfer of care? So there are some definitions that have been hanging around. We know of them for a couple of decades, starting with this definition, which just states that transition is a purposeful, planned movement of adolescents and young adults with chronic physical and medical conditions from a child-centered to an adult-based healthcare system. AAP has its own definition, which states that it's a deliberate, coordinated provision of developmentally appropriate and culturally competent health assessments, counseling, and referrals. So when we think about transition of care, it is a process. It is a process that starts in the pediatric realm at an age that is a little bit early, even before you get into older adolescents. And that process kind of continues through into adult settings. And transition, being a process, is a long-lasting process, whereas transfer of care is something that happens in a point of time during this transition. It is a one specific event where you move from the pediatric side to the adult side. But that transfer of care doesn't mean that your transition of care is complete. Transition of care continues, and that's really important to remember, to think about it in terms of the process and the success of transition. So why is this really important, and why do we need to pay attention to this so much? This is a complex journey, and if you think about it, individuals who are 18 to 24 are emerging adults, and they are people who are going into a new kind of lifestyle. So they may not even be fully independent and may not have completed transition to adult roles in their families, households, or workforce, but they are now going to an adult setting for their medical care. So as you can imagine, there is a little bit of disconnect or discordant there. There are about 18 million US adolescents who are in that age group, 18 to 21, moving into adulthood and will need to transition from pediatric to adult-centered healthcare. And this is according to the 2013 US Census Bureau. Unfortunately, there are also studies that show that up to 80% or a little more than that of these kids who are now adolescents and going into young adulthood are not getting the appropriate transition to get into adult care. So some of the barriers to successful transition have to do with development. And just to illustrate that point, I want to show this image. And this is an image of how brain maturity happens. As you can see, the red and yellow parts here are areas of the brain that are less fully mature. And as you move on to the blue and purples, those are more mature parts of the brain. And this basically shows the prefrontal cortex, where executive functioning, that means where you make decisions about consequences and controlling impulses and benefits of long-term behaviors, are stationed. So if you look at the images, you can see that from a 5-year-old brain where these are still not very mature at all, it takes up to 20 or even more for those executive functional areas to mature completely. And we have to remember that along with these developmental and psychological changes that mark this transition from pediatric to adulthood, our kids, our patients, also have chronic, long-standing disease conditions that may interfere with this normal development. They may have delayed maturity, and there are studies that show that chronic kidney disease can affect cognitive development in our patients. So there is a physiologic reason why transition of care and thinking about it and being intentional about it is really important. So what are these special healthcare needs and children with special healthcare needs? These are kids who have or are at increased risk for chronic physical, developmental, behavioral, or emotional conditions. And so they require health and health-related services of a type or amount that's beyond that required by children generally. And this is really critical to keep this in mind, that the children with special healthcare needs need special provisions when we are thinking about transition of care. So AAP, American Association of Family Practice, American College of Physicians have come together to put a consensus statement talking about what are the needs of children who have special healthcare needs. As such, transitions are part of a normal, healthy development and should occur across lifespan. But in children or young adults with special healthcare needs, transition is more dynamic and it's a lifelong process. So their needs are individualized and need to be more intentionally thought about as they move from childhood to adulthood. So what are some of the challenges to successful transition of care? We know that in transplant, there are very specific studies that look at how the graft functioning happens as pediatric patients go into young adult and adulthood. So this image here is from a study that was done about 5 years ago, showing, or published about 5 years ago, showing how there is an increase in graft failure, that is of the transplanted kidney or the allograft, around that age range, around 17, 18, all the way into the early 20s. As you can see, that forms a period of vulnerability for our patients. Also, this study, which looked at living donor graft survival according to age of recipients at transplant, and goes into showing the months since transplant, what the outcomes was. You can see right here at that age group of 12 to 17, the graft survival is the lowest. And what is really shocking to me is that the next lowest is somebody who's over 65 years of age. So our young children are doing just slightly better than somebody who's over 65 years of age with multiple comorbidities. So there is a need for us to recognize this and know that we have to do better. So there are multifactorial reasons for potential of poor outcomes in adolescents and young adults. As we already talked about the neurocognitive reasons or physiologic reasons with brain maturity. But then there are also psychosocial reasons. There are issues with adherence, as we know. There are, during this time period of life, lot of flux in where the adolescent will be staying, are they going to college, big life events happening. So there's independence, and that also brings along, unfortunately, some high-risk behaviors. There are changes in providers. So going from a setting where you're comfortable with and know a provider from a very young age to a completely new setting with completely new team that is going to take care of you. And then there are immunologic challenges. So just as I spent a little bit of time talking about the neurodevelopment, I'm just going to give a few minutes to this immunologic challenge, just so that we are very clear that there are certain reasons that are outside the control of the adolescent or young adult when it comes to their immunologic state. So after birth, we have the thymus, which participates very importantly in our immune function that slowly involutes. And we have T cells, which are our immune cells, which fight against infections, that initially at birth are naive T cells, but they have the potential to fight a wide array of infections or foreign antigens. But as we age, those cells, the naive cell population reduces, and those T cells become more senescent. There's also more exposure and risk for disease and infection exposure, as well as some dropping of your immune function as you get older. So all of this, if you see right around this age, in that late teens, early 20s, is a period of lot of fluctuation happening in your immune system. So as I mentioned, going back, all of these factors cause the risk for poor outcomes. One thing I have not mentioned here is social factors, especially related to insurance changes, which I'll talk about briefly when we get to that point, but really important to remember that too when we talk about things sometimes that are outside the behaviors of the young adult. So moving on to what we can look at and specifically try to modify that we have some control over. So barriers that we can try to modify include readiness, which is something that we see from both patient and families, and also the provider side. There can be issues with timing. A lot of, like I said, the timing of transition can happen around the time when other life transitions are happening. Parental anxiety goes along with the anxiety of sometimes the patient of going to a completely new setting. Attitudes of staff in a setting may also exacerbate that parental anxiety. People may make comments such as, oh, we will try to keep you as long as possible. We will try to make sure that you are safe with the pediatric side and we won't kick you off. And comments that are made in all honesty, innocently, and in good faith can sometimes come across as if the other side is somewhat scary. And so we need to stay here, or we have to anticipate something bad happening if we go on to the other side. And this is sometimes also because subconsciously the pediatric team is also attached to you as a patient and wants to have the best happen and have sometimes difficulty in letting go. Adult teens have their own concerns. There may be specific conditions that are very common on the pediatric side, but not so common on the adult side. So they may need to be more familiar with those conditions on their own without having seen a lot of those patients. And also the adult teens have concerns because they are perceived as being somewhat difficult. And as I mentioned before, social and insurance issues always are top of mind, as I will show in one of the studies that we did discussing with our patients and families their concerns with transition. So when we think of some of these barriers, it helps us think of how to overcome them. So putting it all in a nutshell, we can think of successful transition as this little triangle that I have here. And then all of these conditions that need to be somehow met and squeezed into this triangle. And sometimes these conditions are just not amenable to be pushed in here. And some of these conditions are much bigger than what the primary focus should be, which should be on patient factors. But sometimes healthcare related factors overtake those. So how can we somehow accommodate all of these in a balanced way so we can get through this portal of successful transition? So let's talk about each of these conditions one by one. as best as we can to overcome barriers to successful transition. So this group of physicians and providers and stakeholders who take care of patients got together, and in 2018 they published in Pediatrics this report about how to support healthcare transitions successfully from adolescent to adulthood. So there are certain core elements of this transition that were recognized and highlighted, and those are 6 core elements, starting with discussion of transition policy. And as you can see, this begins pretty early, 12 to 14 years of age. And then you kind of go through different skills that need to be achieved. And then around this 18 to 21 years, you think of doing that point in time transfer and integration into adult practice. But transition itself, as we discussed in the very beginning, doesn't end there. You kind of go on with getting feedback and improving your process starting right from here. This is our model that is being put out by these societies, which are American Association of Pediatrics, Family Practice, and American College of Physicians, which take care of the adult population. But similar policies are there in other countries. Just to mention, this is one of the highlights of policy in UK, where they talk about how individualization and disease-specific education is really important, and also flexibility in transition timing, which I think is also really a good point to keep in mind, because there are some young adults who may benefit from even a year or two into their early 20s before they go into that adult setting. And there may be some who are ready at 18, and as pediatricians, we may do a disservice keeping them in the pediatric setting. So just highlighting those 6 core elements again, I want to just mention that each core element has a pediatric side and an adult side. So it's important really for the pediatric setting and the adult setting and the providers from each of these settings to work in tandem and work in collaboration. And a lot of this, you'll see communication becomes a key. So we start with having a transition and transition care policy, which is to be discussed and, if possible, created with the help of the youth and family. And again, when they go on to the adult side, this should be rediscussed and reaffirmed that does this now meet your life needs. Tracking and monitoring throughout this, specifically looking at transition readiness, and then going on to transition planning, which includes preparing a medical summary, making sure that there is a lot of communication between the adult and the pediatric setting. And then at the time of transfer, in addition to the communication, making sure that the young adult's needs and concerns are met at the very initial visit with the adult people. And then, as I mentioned before, obtaining feedback and making sure that the transfer is complete and the feedback is utilized to get started again in this whole cycle. So what can patients and families do on their end when we think about all of these components of transition? So let's start with our patient factors. I really like this 7 C's that has been discussed by AAP. And as we know, our patients and our children, young adults, adolescents who experience chronic kidney disease or any chronic disease for that matter, for them, it is a marathon. It's not a sprint. It's a long process, and they have resilience that have brought them through, and that is what will take them through into a successful transition. So the 7 components of resilience are competence, and that is basically knowing that you can handle difficult situations, having confidence in your own ability, connection, which is really key with family and community, character, knowing what is truly valuable and important instead of your moral values, contribution, a sense of purpose, motivation, and serving others. And this I really highlight specifically because a lot of the adolescents and young adults don't realize this, but they are role models for younger patients who are following in their footsteps. So I use a lot of examples of older teens young adults who have been successful navigating schooling, getting a job, going into seeing the adult providers, to the younger patients who I start seeing, because truly they are the path breakers or pioneers in this. It's important to also think about coping and knowing that your actions make a difference in your own health outcomes, so having control. So I really try to incorporate these 7 C's into our clinic visits and discussing with the parents that this is really important. And if you kind of look back in the history of each patient, there are certain big events that they have overcome already. So it's important to build on those successes so that confidence is built, that they can take care of their health and build up on what they have already achieved for future successes. We also looked to see what specifically matters, what is important for patients and families. So this was a survey we gave, or assessment of the survey we gave over a period of 3 years when our new patients came into our adolescent or teen clinic for transplant. And this is still ongoing, but the initial kind of look showed us that there are lots of similarities between what the parents find important and what the adolescent and young adults think needs focus on. A lot of it is talking about insurance coverage, as you can see. Adolescent and young adults really want to be able to schedule their own appointments. They are concerned about not knowing what to expect when they go onto the adult side, but they really look forward to being able to make their own decisions, which kind of follows along very closely to what parents and caregivers are also thinking about. They also worry about insurance gaps, and they also want their adolescent and young adults to take on more responsibilities. So this is something I think also important from a patient and parent perspective or a caregiver perspective, to think of what are your goals when you go into this early transition period. And as we discussed before, the early transition period starts around 12 to 14 years of age. So you can potentially have your own discussion of what do we need help with, what are our concerns, and what are we actually looking forward to, because at the end of the day, this is a normal process and could be really exciting if done thoughtfully from the very beginning. So some of the helpful models to think about when we think of transition, and you may have heard of these, but just reinforcing them, is about a new skill acquisition model about how somebody learns to drive a car. Obviously, you're not going to give car keys to a young child and tell them to take off and go onto the highway. There is this whole process involved where for years they are just watching. They're just sitting in the back and watching how the parents drive. Then they come on to maybe sitting in the front and watching you a little bit more directly on how the processes work. And then when they start learning how to drive, everybody's anxiously sitting next to them, behind them, just watching them and giving all kinds of advices and making sure everything goes correctly. And after several of such trial runs and test runs, finally they get to have the key. And even then, you may actually still have them drive around smaller roads before they take off onto the freeway. And even when they take off on the freeway, you have lots of instructions and make sure that they get where they need to go finally. You may even have people watching over them, making sure to text you or call you when they do reach the destination. So that's something I think gives you a little bit of a sense of how the process should work, and kind of important to explain to the families and teens that, you know, this is a process and this leads to success. So just have to be patient and do it right. The other model that is talked about is the shared management model, where basically the parent or caregiver initially is the care provider, doing everything, making appointments, getting refills, scheduling visits, making sure the medicines are taken at time, and every other nuances that come with caring for a chronic disease, to becoming a bit of a manager, to becoming a supervisor as the roles slowly shift on to the teenager or the young adult, to being a consultant, and finally you're a CEO, where you're just making sure things are happening and the tasks are delegated but are being carried out successfully, and that brings happiness to all at the end. In both of these models, what I do want to highlight is, even though in a stepwise staged manner, the responsibilities pass from the parent or the caregiver to the patient who's a adolescent or young adult, it's really important for the parent and caregiver to not completely be out of loop even when this stage happens. They are the support system, they are the safety net for our teens and young adults. So it's really important to stay connected and keep checking in, because life circumstances happen and things change. So that is a key point that I reinforce again with the teens and the parents, caregivers, families, that the communication is key, and the teens should never feel hesitant to ask for help, and the parents should never feel hesitant to check in on them. So that is something I just want to reinforce here with both of these models. Now, what can healthcare settings do to prepare successfully? So as you know, the pediatric setting, we talk about starting early, 12 to 14 years. We try to provide resources, making sure they know how to fill prescriptions. We have some mock ways of steps that the team can get comfortable with, including calling in to fill prescriptions or using the automated service. There are several apps that help with medical management, with timing of medications, making sure that there are alarms on the phones and reminders that are helpful. Outpatient labs and other services, making sure that those are accessible for our families. To-do lists or specific expectations are really key and help in the pediatric setting for the teens and young adults to know what are the next steps they can look forward to. Important to discuss what becoming an adult means and what it specifically means with the chronic condition they are going through. I put in here my chart info, which is basically just an EMR, if you have availability of that, where the families themselves can look at labs. We really encourage our patients and families to have that, and they can be familiar with what their numbers look like, what options are there to communicate with their healthcare teams. Many now have options of emailing your providers and reaching them pretty quickly with this. It's really important for the providers to discuss what are the differences in each settings. And there are many differences that really will help both the teams and the patient and their parents to know about. For example, in our transplant population, our pediatric teams see one provider, meaning one kidney specialist who takes care of their chronic kidney disease needs and also their transplant needs. Whereas on the adult side, because they have so many transplant patients, they are a little bit more specialized, where they need a general nephrologist to take care of their chronic kidney disease needs, such as hypertension refill for medications, or as other acid-base related disorder conditions that are treated by the general nephrologist. And the transplant physician takes care of immunosuppression, preventing rejection, and those things. So it's really important to let our teams and our patients know ahead of time that when you go into the adult setting, you need two providers instead of one a nephrologist and the other a transplant provider, so they can plan for it. And that's one example of differences, but it's important for the teams to know what are the differences and if there are any major ones that are there. I keep coming back to this point about celebrating successes. This is really huge for us. We celebrate all kinds of events, which may be big or small. To us, they're all major events, graduations, any new jobs that our patients get, and really important to, in the context of chronic disease, know that those actually build up to successful lifetime outcomes. It's important then to establish a transfer date. It really helps to know that after this visit of this month, you'll be transferred over to the adult care. So things can be wrapped up and you can create an environment of looking forward to that adventure. Communicating again with the adult counterpart is key. And I cannot emphasize enough about that communication, which could actually be in the form of sending on a medical summary, but I always highlight direct communication and encourage that between the teams, because there are so many small aspects that become big when not communicated properly. So there may be specific things you know about your patient because you've been taking care of them very long, what motivates them, things that as a family they find important. Sometimes you may see a patient and their parent, but you may never see a grandma who is really one big influence in the care of what the patient eats or in their medication taking motivation. So really important to communicate directly whatever information you have about the patient and the families, and also really important for the patient and the families if they know of something that they would like the adult healthcare team to know, because this communication, at least in our setting, happens very frequently. And once they are on to the adult setting, as we move on there, it's important again for the adult providers to communicate with with the pediatric counterparts. And again, at the very first visit and for the few initial visits, discussing similarities and differences from the pediatric settings. So I'll again give an example. Medication refills, they may have a different way of addressing that. Appointment scheduling might be completely the responsibility of the young adult, and compared to pediatric setting where the patient is called by the team or you are emailed by the team, that may not happen in the adult setting. It's important to make sure as parents and patients, you also ask questions about what is that process. Are we expected to call you after a certain period of time, or do we leave with an appointment here? Medication responsibilities, who gets to call about refills once patients are over 18. Some of the adult settings do not accept calls from parents asking about medications because of HIPAA and other regulations. So important to make sure that the parent and patient responsibilities are clearly defined and understood at the adult setting. And it's important also to make sure that the changes are gradual, because again, like I discussed about differences, in our pediatric transplant population, our regimen, our schedule for labs and follow-ups are a little different from the adult side. And initially, when our patients go on to the adult side, our adult providers really try for the first 6 months or so to stay within that pediatric regimen. So huge changes are not happening. It happens in a stepwise manner. So going from monthly labs and every 3-month visits, they may change it to visits every 6 months after the first year of moving. So those changes, it's important to also know what are different, and can that happen also gradually if that is what makes you as a parent and a patient more comfortable. And it's really important for that communication loop to be closed back from the adult side back to the pediatric side. So we are all speaking the same language, giving the same message, and making sure that our patients get the same information, because at the end of the day, that is what is critical, that our patients are well equipped to go from one setting to another. So now one particular thing that I was really appreciative of Kristen to note specifically for me to talk about is preparation as our patient is going off to college or to a completely new setting. And this is a little code that I have here, PAM WISE, and with a double S. So know some basics about your disease. It depends on what your disease is, but at least know what the condition is, what might be some exacerbating factors. If you have looked at my chart or your labs, really good to know some baseline numbers, especially for kidney. What is your baseline creatinine? Just some very basic information, and you can discuss with your physician, your providers, what that basic information should be that you should know about. Know your allergies, really important. Know your medications, why you take them, and where to get refills. What is your source of getting that? Is it going to come home if you're at a different geographic location and you're somehow getting it from there? Or are you going to get it shipped to your new college residence? Sometimes, if the list of medications are really long and cumbersome, it may also be more practical to at least have it on your phone or have it in a way that you can pull it up, even if it's not difficult or challenging to memorize each one, but know them and or have a way to have it in front of you when needed. Then we get to the wise part of it. If possible, get a written summary of your condition or keep it on your phone, at least the highlights of what is important. And then some of the intuitive things that you know when somebody talks about, how to be healthy. Make sure you exercise, eat a balanced diet, sleep. And did I talk about sleep? Get good sleep. That's really, really key, especially for this age group, to make sure that you are getting rest and able to focus on multiple things in your life and with your medical condition. One thing I really tell all of our patients who are transitioning to college life is to make sure they go and meet with their student health on campus and also their counselors. It's really important to establish a good relationship with them to make sure they can lean on them in difficult times. And finally, the E, which is preparing for emergencies. You can make sure that there are numbers for your physicians, for your teams, for your pharmacy listed somewhere. Talk to trusted people. If you have a roommate, again, your counselor, people around that know who to reach out to if there's emergency situation in your college or while you're there. So moving on from there, I just wanted to spend a few minutes talking about our transition program and some of the things just to kind of tie it all together. Our goal of the transition program for our kidney transplant is to provide individualized care and smooth passage of our transplant patients from pediatric to adult care for the best possible patient outcome. So we start early. 14 years is when our transition program starts, and for transplant, they have to be at least a year out of their initial transplant and stable. We really, as I said, support achievement of normal developmental milestones and celebrate those achievements. Ongoing education, and this is really set out. We have a written plan for transition with goals that we expect the adolescent and young adult to meet, and we review that with them. We provide general medical care, obviously, but also preventative services such as vaccinations and nutritional services. And it's a multidisciplinary team that we are lucky to have for this group of patients. We talk constantly about areas of concern because that changes as the adolescent advances from a 14-year-old to a 16-year-old to an 18-year-old. And very importantly, I maintain a very regular open communication with our adult teams. We talk almost every month at the minimum about patients who are being transferred, patients who are going to be transferred, and patients who have been transferred, to make sure that we are all on the same page and there's closed loop communication. And we make sure that other services, also the transition happens. Some of our patients need urology, rheumatology, and other providers and teams who we want to make sure have also successfully transitioned from the pediatric to the adult side. As I said, it's a multidisciplinary approach, very collaborative. We try to have a written plan. We have a readiness checklist that we make use of. We use in our setting something called RTQs, which is a readiness to transition questionnaire, but there are different kinds of checklists which can be found in the specific website called transition.com, which really has wonderful resources. There are track, which is TRAQ, which is a checklist that can be used. We assist with insurance issues, making sure that that coverage continues or whatever help can be potentially offered for that. And as I mentioned, coordination of care, preventative services, and really important at the end of the day is to be excited about this journey and letting go when the time is right. And a typical clinic visit includes a lot of visits by providers, but we try to make sure that labs are done before the visit so I can pull up all the results. I encourage all of our parents and our teens and young adults to look at the labs on their own on my chart, but I also discuss the real basic ones with them. And then we talk about all these stepwise approaches. And as parents and patients, I also encourage you to ask that question, that how does a typical visit happen? What are the components of transition that are discussed at both the pediatric visit and the adult visit when that happens? So what are the key concepts of this successful transition? Really important to establish that trust and respect and giving time. Also very important to be honest. There are certain things that I would like to discuss with our pediatric patients, our adolescent and young adults. I may not have answers to all the questions, but I will know somebody who has, so I'll try to find it. So it's really important to make sure that there is honesty and shared decision making. I try to make sure that whatever changes we make, whatever new steps we are going to take, whether it's for exercise or nutrition, actually has support from the teen and their families. And absolutely important to pick your battles because as we know, everybody has good days and bad days, and we try to be productive and move past some of the bad days. But I have always found that if we have good expectations, which I have for our teens, they rise up to meet them. So I do give them positive feedback on that. I tell them what our goals and expectations are, and we have a really good, open, two-way communication. And as I mentioned at the very beginning, I always encourage peer and family involvement, even though the key is for the adolescent and young adult to be independent. We are never independent, or I should say never outside of our peer and family support group. They really can bring a lot of strength to this process. So from our end, we try to make sure that we have our support follow-up networks, but also simplifying the medication regimen as much as possible and individualizing the medications, and really trying to make sure that if possible, we can within the group find support and mentoring. So we have teen-specific camps for our kidney transplant patients that really fosters a lot of friendship and creates these role models that I was talking about earlier. And all of these are supported by research and studies that have been done. So we try to incorporate that as much as possible. So at the end of the day, as you know, a physician's or a provider's prime responsibility is the medical management of the young person's disease. But the outcome of this medical intervention is irrelevant unless that young person acquires the required skills to manage their own condition and their life. So truly, we see you as partners in this journey. So I will, before ending, just mention this one episode that happened a few months ago with one of our patients, just to give you the context of why all of these things that we talked about is important. This was a patient who was in our transition program since she was about 15 years of age. Over time, in a stepwise manner, she kind of got all of those components of transition, the knowledge components and the action components under her belt. And when she was 21, she was transferred to an adult setting. And a month after, she needed to go to the emergency room. This is a patient who had a transplant, and she, because of all our discussions and our goals and expectations, kind of had learned all those bullet points that we had talked about. So she went to the ED with a possible UTI, urinary tract infection, and they did labs and told her that, hey, your creatinine is 5. but it might be because you have a UTI. So how about we give you some fluids and antibiotics, and you can go home and come back in a week and get this checked. And you should remember that this is COVID times, and she was now in an adult emergency room where only she was allowed to go inside because only one person can go in that age group. And immediately when she heard that, she said, "What do you mean my creatinine is 5? That's not my baseline. That's really high." And I was told that since I have a transplant, if my creatinine is higher than my baseline, I need to get fluids, I need to get admitted, I need maybe a biopsy of my kidneys if it doesn't come back down. And the ER staff was shocked, but she was a true advocate for her kidneys. And they admitted her. And that same night, unfortunately, as these things happen, it was Friday evening, so going into the weekend, she sent messages through her portal to the adult providers. And because she wasn't 100% certain that they would get it, she also sent messages to us, which is something that we tell all our patients, that it's really important that you reach somebody, and we will still facilitate care. We are never going to say that we won't listen to you after you're 21. We have been taking care of you, and we will make sure that we will facilitate that. So she sent messages to us too, which I got close to midnight on that Friday evening. So I was able to pass it along to our adult providers, and who is really wonderful. So immediately the next day morning, she called the patient, and long story short, she got antibiotics, she got fluid, she got treated. She didn't need to get a biopsy at that time, but her care was really critical for a few days, and all that had a great conclusion in that her creatinine came down much lower, and she was able to be discharged in very safe manner. So in conclusion, none of us would have been able to help her if she wasn't able to help herself in that situation to begin with. So when we go back and think of all these factors that we have to balance and modify to talk about successful transition, it's really important to know that the patient factor reigns supreme, and all the other factors are important but need to be balanced out and gotten into that portal of transition. And if we are able to give each the importance they deserve, we finally end up with successful transition. And as I kept talking about, collaboration, communication is the key to all of this. These are some resources here, and thank you all so much. Just another quick mention of this website, Got Transition. It's really great and has wonderful resources for providers, patients, families. With that, I'll stop. Happy holidays to all of you, and thank you so much for your attention.
Thank you so much. We do have a couple of questions for you. One, a patient is, or a family caregiver is asking that their pediatric hospital automatically refers to a particular adult hospital, and they haven't heard, they've heard some things that are concerning. How would you suggest bringing up the pediatric team that we would like to go to a different hospital?
So I would say that it's really key to be open and honest with the pediatric team. And it may be important also to bring up what your concerns are with the adult hospital. And this is part of, at least for us, and specifically, I try to be very mindful of this, because their discussions need to happen between the providers of the hospitals, because there may be things that the adult hospitals can also change, very minor things that can improve that process. There could be things that are outside their control, even small things such as scheduling appointments, small changes that even the adult hospitals could make. So definitely discuss with your pediatric hospital. Your pediatrician will do what is best for you, even if they have that kind of relationship with the adult hospital. We transfer most of our patients to Emory, but we have had sometimes patients who live close to Piedmont or Northside, and they request that, and we never stand in the way of that. We want to do what is best for our patients and what is their wish. So definitely discuss that openly and honestly with your team.
Thank you. I have another question for you. What if my hospital or healthcare clinic does not have a transition plan or policy? What should my priorities be to start the process?
That's a wonderful question. So I would say definitely go to that website if you like to get something very concrete, which is gottransition.org. You could just find out some of the checklists and things like that. I would prioritize, like I said, knowing about some basic information about your disease, knowing about medications, making sure that in a stepwise manner, you are able to do things that somebody else would be doing for you. But importantly, try to find out also what are the big differences in both the systems. Are there differences in how visits are scheduled, how labs are ordered, timing of things? So I would say, try to make a list using those resources you have and discuss with your pediatric team, and also ask them specifically what they should think about when you go to the adult side, so you are prepared on both ends to go from the pediatric to the adult side. And maybe you will be the encouragement for them to come up with the program. So keep pushing them.
Yeah, that's a great idea. A couple more questions. And I know that our time is getting limited. So if you don't mind, if we don't get to all the questions, I would love to be able to send them to you. Maybe you could help answer and I can send them out to the appropriate people. But one of the attendees says that her daughter has several comorbidities and she sees 8 different specialists. What advice can you give in transitioning into this less collaborative kind of adult world?
Yeah, so I would start by saying that, go in good faith, go to the adult world and expect them to be collaborative. Say that, we have had this collaborative association in our pediatric side. These are the physicians I want to be seeing the child. These are the services I need, and what are the ways for me to get this? Know that the adult side has resources, but it's a little bit different in the sense that we will have in the pediatric side our social worker coming in to see the patient. On the adult side, you have to ask, can I see the social worker? And they do call them, but that initial request has to come from you. So I would say go there with that expectation that they have to rise to that occasion. And to be honest, they have resources to do just that. So have a list ready, be prepared, and ask of them what you need. And also just leaning back on the pediatric side at the very, at the very initial chances you get of making sure that all those different providers are transitioned to the adult side in a smooth way, but have one coordinating person, whether it's your adult primary care person or one of your adult providers who will be the primary coordinator of this.
Thank you. One more question, if we can just take 2 minutes of your time. So Melissa is asking, she has a 17-year-old daughter who was diagnosed with C3GN just 2 months ago. She is at end stage and started dialysis immediately. And she's hoping to get a transplant in the next maybe 6 months from a living donor. She's planning to go to college this fall. So she's wondering if if you have advice on how she can speed up some of the transition so that her daughter can also how her daughter can also process some of these changes as well.
So to clarify, speed up the transition, meaning you would like to go from a pediatric to the adult setting sooner? Is that
or maybe having her daughter more engaged since she's going off to college, right? Mm-hmm.
Yes. So the important thing, I think, especially initially with the diagnosis that's so significant, is to know that it takes, all of us time to process some of these big life changes and big life events. So be the support that she needs, and do it in a very stepwise manner. Even before she goes to college, maybe start by seeing what resources you can have, such as apps on her phone, because kids are on their phone. So are they able to have some kind of apps for medication adherence? Share resources that you have for care, the steps involved into transplant. What are the responsibilities after transplant? So making sure that in a stepwise manner, your teen has involvement in their care. I would even practice with them filling their pill boxes, making sure that they are calling in refills, just making a list of things that you are doing at this time for her, and then one by one having her do it under your supervision. She will get there, believe me. They are all smart kids and they all get to that point. Sometimes it just takes a little bit of time just getting that, digesting this big life change.
I think that's great advice. I think that arming our young adolescents and children with education, I think is probably the first step. And I think that's a great way to end this webinar. Thank you so much, Dr. George, for being here. The website that you mentioned was gottransition.org. Is that correct? Yes. And like, as I said in the beginning, I will be sending out, maybe I didn't mention it, but I will be sending out a follow-up email to all registrants with a recording of this program and an evaluation form. I would hope that everyone that's here would be able to fill that out for me. And anyways, thank you again, Dr. George. Have a wonderful day. Have a happy holidays to you and your family. And I hope that we can be in touch very soon. Thank you so much, everyone.
Thank you so much. Good luck.
Thank you.